Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and we're getting into a little more edgy territory. And it's ironic because we've talked about the fact that you have the most financial protection when you're in network. And that is true, but nevertheless, there are many situations in which bills from in-network providers are incorrect, and we don't want to get into the motivations, but let's face it, it's easier to get the money from the patient often than from the insurer. So I did a take of this that was far too long, so I just want to try to stick to the facts and give people examples of how this happens. In the past, I alluded to being asked for payment before the claim has been processed. That shouldn't happen. I know it's commonplace, but it shouldn't happen with an in-network provider. An in-network provider is supposed to submit the claim. The claim is processed. They get an explanation of benefit statement. If they believe the claim wasn't processed correctly, they should be working with the insurer until it is. And then the member responsibility amount reflected on that explanation of benefit statement, which the insurer issues, is what the patient should be billed. So I gave an example previously of, my husband's dentist, and I've had the same thing happen. We see it, it's common, but it shouldn't happen. So if you're put in a position where you have to pay, you have to pay, but then check the claim information on the portal we advised you to set up. That's how I could see that my husband had actually overpaid $112, which is not a lot of money, but as a percentage, it was. And he didn't know it. And providers do not have the right to overbill you, and that's just the way it is. So another example, my chiropractor, I think that was a more innocent example, but they were charging me $35, which is the specialty co-payment. I didn't have a lot of visits. I injured myself playing tennis. I just wanted to go and get some help with the pain, which I did. They were wonderful. But when I looked at the benefit on my website, the co-insurance was what they should have been collecting, 10% co-insurance, and that was $7.08. Now, there's a big difference between $7.08 a visit and $35 a visit. I didn't have that many visits. But when I first raised it with them, they said, well, we don't even have payment yet from the insurer. So, and that was correct, but as soon as the insurer processed, they refunded my money. But again, you've got to be aware of these things. If I had had many, many, many visits, or the charges had been more significant, it would have been more money. So let's move on to, I'm using examples from my life because that's simpler. I know them. And last summer I had a sinus infection and I couldn't recover. My doctor ordered a COVID test. Very reasonable. I had it on August 6th. On September 11th, I got a bill for $128.08. It is ridiculous that this went back and forth between the insurer and the provider for so long. They ultimately were paid $74.30. But when I got the bill, I knew immediately that it was incorrect. I had already met my deductible. Remember, if you've met your deductible, then the insurer should pay something and you should pay something, either co-insurance or a co-payment. This bill showed no payment from the insurer. So I called Stanford Hospital. I left a message. Nice try, but I do not owe this. It's very unfortunate that a claim as insignificant as this went back and forth. I can't tell the whole history, but the hospital wasn't paid until 2021. So charges were $225. They end up being paid $74. Months and months later, it just shouldn't be. All parties should be held accountable, and we'd all be better off. Last example is the much more egregious one that I have alluded to previously, which is, a lot was going on last summer. I got an infection. I couldn't recover. There's COVID. There were more things ordered for me than usual, and some sophisticated lab work. Now, the Stanford Pathology Group ultimately was paid $2,089 and change for that lab work, but they sent me a bill for $4,907 in December for work done in August. And again, I had been online looking at my site, seeing that Cigna was asking for more information, which probably was very justified. You don't do everything on everybody. This wasn't routine. This was more sophisticated work. But the information kept being resubmitted, the claim information, without the additional information requested. But anyway, when I got this bill, which certainly looks legitimate, I called them and left a message, nice try. And ultimately, they got paid the following month because I can leave a message that conveys, I know what I'm talking about. So anyway, I don't want this to be a lengthy video that's too much to absorb in one sitting. So this is enough information for today. I wanted to corroborate my last statement. There's too much trust. There's too much trust that medical bills are accurate. So please don't be that way and know that when you pay a bill, it's actually what you owe. Thank you very much. Thank you for listening, and we will see you again very soon. Bye-bye.